Welcome to Managing Myeloma. I'm Dr. Ajay Nuka. I'm frequently asked, what are the practical considerations in management of the most common adverse events with proteasome inhibitors? The three proteasome inhibitors that are currently approved are bortezomib, carfilzomib, and ixazomib. Bortezomib has been existing for myeloma therapies for the last 15 years. The main side effects that you see with bortezomib are the peripheral neuropathy, as well as the risk for herpes zoster eruptions and some GI toxicity. So how do I manage the peripheral neuropathy? Again, it is very crucial to identify the at-risk patient who has a prior history of peripheral neuropathy from the disease itself, or when you're using in patients who have prior history of other neurological disorders, prior history of diabetes, which predisposes patients to have diabetic neuropathy. These are all the things that need to be taken into consideration even before starting the dosing. And appropriate dose reductions are extremely crucial. Making the dose reduction at the first sign of a grade 2 toxicity would certainly prevent any further progression of this peripheral neuropathy. Also, what we had seen over the last 5 years is when we changed from the IV administration of bortezomib to subcutaneous administration of bortezomib, the rates of peripheral neuropathy, the rates of grade 3 peripheral neuropathy have significantly come down, almost from 16% to 6%. So appropriately identifying those symptoms and giving them vitamin B certainly can help with the scenario of the peripheral neuropathy. The second proteasome inhibitor is carfilzomib. The main side effects with carfilzomib are fatigue, anemia, and I would appropriately treat these patients by giving them stimulants if needed, by giving them, for anemia, giving them transfusions as needed, taking off any offending agent that is causing, making sure that the other causes of anemia are taken care of. All those things are very, very appropriate. And the one most common side effect with kyprolis one most important side effect, not the most common side effect, is the rate of cardiac events. Uncontrolled hypertension, cardiac failure, dyspnea, these all need to be watched out for very, very closely when you're using a carfilzomib-based regimen. The third proteasome inhibitor that was recently approved is the ixazomib. Ixazomib is one of the most easy drugs to take. The main side effects that you see are the GI side effects as well as rash. So rash, these are not very common. These are less than 10% of the patients. The GI side effects are seen in a lot of patients, but the grade 3 side effects are seen in close to 6% of the patients. So appropriately giving them the right antiemetics, appropriately giving them the right PPI would certainly help mitigate these toxicities.